Hello, everyone. Good morning, good afternoon, wherever you are. So we'll get started here. So welcome to the hashtag Vaccine Ready College COVID NU. Where this is hosted by the LTA COVID Task Force, the Undergraduate Affairs Team, and the Expansion Committee. Hi, I am Kat Baltera. I will be the facilitator for today. I became a sister at Eta Alpha chapter in the spring of 2018, founding line at the University of Northern Iowa. So I'll be kind of talking with you today. And then we just kind of wanted to welcome you all and just like let us know where you are from in the chat. If you're a sister, what chapter you're from, where it is located, university. If you're not, like which state you're in. So let us know down in the chat. All right, we got Epsilon Phi in North Carolina, Gamma Tau. Delta Phi. A lot of California. Gamma Chi. Gamma, Beta. Delta Rho. All right. We got a good crowd, good crowd. So just to go over the agenda for today, we'll do some introductions, kind of what is the National Minority Health Month, COVID-19 Task Force updates. We'll have a Q&A section, one about hashtag vaccine ready and one about community impact. We'll do a guided meditation and we'll have closing remarks. We will be taking questions also throughout our presentation. Use the little Q&A button at the bottom right next to the chat if you do have any questions throughout the presentation. And then I'll kind of speak on the National Undergraduate Affairs Special Committee. I am a part of that. Currently, it was established in 2019 as a task force just to provide like a safe and open space for members just to like create undergraduate focused initiatives. We kind of work with PEP, so the Pursuit of Excellence program, that all chapters, undergraduate chapters fall under. And then we do getting A's with LTAs as well. And then we do host collegiate chats. In 2020, it kind of evolved into a special committee. It focuses on like feedback from our undergraduate members in regards to important topics pertaining to the undergraduate experience. So just anything that we're kind of needing help with, maybe needing some more clarification on. So that's kind of what we do. And I will hand it over to the Director of Recruitment and Retention.
Thank you so much, everybody, for joining. So my name is Wendy Castro, and I actually, under my role, I also work under the Expansion Committee, which helps to develop what our sororities expansion policies will be, where we're going to go next, right? So we specifically work with our expansion sites with interested members who want to establish a new chapter, or we also work with our interested members who want to reestablish and bring back a chapter that maybe has gone defunct over time. And we really love our interested members, and we really want to make sure that we're including them in every aspect of LTA and what we do, as well as just developing as the wonderful individuals that they already are when they come to LTA. So thank you so much for coming. And I'm going to go ahead and turn it over to my wonderful sister, Krystal Chan.
Buenos dias, everyone. I'm Dr. Krystal Chan. I am part of the LTA COVID-19 task force. Unfortunately, Dr. Vidot was unable to join us today, so I'll be taking on the majority of this. I am an assistant professor in the Department of Internal Medicine at the University of New Mexico, meaning I take care of patients 18 until death. That's kind of like what I like to say. And I do primary care and hospital medicine. Last year during our pandemic, I did predominantly COVID care for about 6 months, and then went back to clinic and doing a little bit of COVID care there, just kind of bouncing around. Thankfully, we have seen a decrease in case numbers, so that's wonderful. About a year ago, I was contacted by leadership in the sorority to start this COVID-19 task force. They had heard that I was doing COVID care, and we had just had so many sisters reaching out to us, asking when their parents were infected or they were infected, and they just wanted more guidance. So we created this task force to guide the sorority, the organization, for kind of just protocols and algorithms for how to do recruitment and retention. And so this is how this came about. I also wanted to just quickly say I am first gen. My parents were born in Yucatan, Mexico. They crossed here in the 70s, 80s. So I'm the first one in my family to go to college. I'm the first one in my family to become a doctor. I did cross spring '08. I'm a founder at UCLA. I majored in biochemistry. Was really, really difficult. I'm from East LA, from Baldwin Park, right where the 10 and the 605 meet, if you know where that's at in Cali. And just really encountered a lot of obstacles as being first gen and being a brown woman in STEM. Really felt out of place and kind of lost at UCLA, and found LTA, which really set the foundation, I think, for a wonderful career. I get to meet sisters from all over the nation now doing the work that I'm doing. I'm so thankful for Dr. Vidot, who is doing research. We're pretty similar in our career trajectories, and just really fortunate to have the sorority, as well as alumni sisters. I see Wendy there, who I've known since I was a baby interest many, many years ago, maybe 20 years ago now. And just so excited and happy to be here. Thank you.
Yes, so I'll take it back. So kind of just going over what is National Minority Health Month. So kind of the FDA Office of Minority Health and Health Equity. It just kind of highlights important issues impacting diverse communities year round. In April, National Minority Health Month offers opportunities to amplify these efforts. So this year's theme is #VaccineReady. The focus is to empower communities to just get facts about the COVID-19 vaccines, share accurate vaccine information, participate in clinical trials, get vaccinated when the time comes, and practice COVID-19 safety measures. So that's just a little bit about that.
Okay, so we do have a short video from the office. So let me go ahead and get started.
Hi, I'm Rear Admiral Sharde Arojo, the Associate Commissioner for Minority Health and Director of the Office of Minority Health and Health Equity at the Food and Drug Administration, or FDA. At FDA, we are focused on using science to protect and promote the health and safety of the public. Over the past year, we have worked diligently to seek answers and reach sound decisions to help address the COVID-19 pandemic. We've made it a priority to ensure diverse communities have accurate, credible, and reliable information to make informed decisions about their health regarding medical products that diagnose, treat, and prevent COVID-19. You can find a range of COVID-19 information on our website in multiple languages. We have a variety of educational resources like videos, fact sheets, and toolkits, so you can learn more about FDA's emergency use authorization process for medical products, including vaccines, diversity in clinical trials, and how to protect yourself against health fraud, among other topics. To get the most up-to-date information, you can sign up for our e-alerts to receive weekly updates on COVID-19 and follow us on Twitter. I encourage you to stay informed and share our multilingual resources with your family and friends. We will continue meeting with public and private stakeholders to gain input about the best ways to reach diverse communities and to ensure we are developing useful tools to help you make informed decisions. Building trust and confidence in our work is key to help end this pandemic, so we can get back to seeing people we have missed and enjoying the things we love doing again. For more information about COVID-19, please visit www.fda.gov/health-equity and follow us on Twitter at FDA Health Equity so you can ensure you are vaccine ready.
Perfect. So I will hand it off over to Krystal.
Thank you. So I'm going to do a quick little review on coronavirus, COVID trends and updates. Next slide, please. So this is data that I just pulled. This was published, I think, on Thursday, so it's pretty current. These are the national trends in the number of COVID cases. So as you can see, this goes for a year from last March to this March. You can see our huge spike that we think was probably because of the holidays, Thanksgiving, Christmas, New Year's. As you can see, we peaked right around early January, mid-January, and we slowly started coming down. This is likely secondary to the vaccines that we were all obtaining. But as you can see right there on March 31st, we're starting to see an uptick. So we saw kind of a down peak, and now we're starting to see a small surge coming up. We are predicting another, this would, I guess, be our third surge technically, coming in the next couple of weeks. That is probably going to be compounded secondary to this weekend's holiday. So I'm continuing to urge everyone to, if you're not vaccinated, to not gather, spend the holidays virtually. Again, like I said in December, this is just a year that we have to kind of sacrifice for us to all be safe and healthy and present and alive for next year's holidays. This data was pulled from the CDC. Next slide. This is the change in new COVID-19 cases. So we want to see the entire map in that turquoise color. That means that there's decreasing cases in those states. So if you want to look for your state and see what you're doing. Steady is gray, meaning the cases are steady. They haven't changed. They haven't increased or decreased. And then the brown and kind of like the darker brown or the tan and brown are increasing cases. So as you can see, there's like a hodgepodge of things going on. We have a couple of states that are in the turquoise color. Most big states are in that steady or tan color. And there's only a few, unfortunately, New York, I think, is going to see another surge like they did last spring that are increasing. Again, the source is the CDC, and I have the DC and Puerto Rico data, as well as Alaska and Hawaii down there, which are all in the tan colors. Next slide. I really wanted to spend a significant amount of time going through this graphic that I made comparing all three of the vaccines. As you know, we've had the Pfizer and Moderna. Pfizer is actually the one that came out first, and then Moderna maybe a week or two later. And then now we have the Janssen that was just approved. I want to focus on the efficacy. So the efficacy means that over the X amount of time that they followed up these patients in the study, they were 95% effective in the Pfizer trial of decreasing COVID infection. And we said this in December, this is like phenomenal, never heard of efficacy rates. The flu usually every year is about 40% effective, which is like, it's less than a coin flip toss. 95% is like, never before have we ever seen something like this. Like, I really want to stress that this is history in the making, and this is kind of a global, worldwide effort. This is why the efficacy is so great. For the Moderna, it's about 94%, and Janssen actually has the largest kind of like multi-country, multi-continent study. They actually broke up their efficacy by countries. And so for the US, it's about 74%. I think overall it was about 70%. There are some countries that are 60%. And then I think South America was about 80%, or Latin America was about 80%. So kind of variable. I did want to stress how many patients are enrolled in these studies. So for Pfizer, it's about 36,000 patients. Moderna, it's about 28,000, and Janssen, almost 40,000. And I wanted to highlight the number of Black, Latinx, and Indigenous patients that were enrolled in these studies. When the Pfizer and Moderna came out back in November, December, we saw very small numbers of our kind of constituents represented. Black was about 10%, Latinx was about 20 to 28% in the Pfizer and Moderna. And then Indigenous population was like 0.5, 0.3%. So very few participants that identified as that race ethnicity. For Janssen, however, I just pulled this data. We don't really have a lot of Janssen doses in New Mexico, so I haven't really looked at this data. And I actually was wonderfully, pleasantly surprised of how many Black patients they enrolled in this study. About almost half of the patients were Black, identified as Black, about similar Latinx, maybe a little bit less than the rest. And then they had 9% Indigenous patient population, which is the most that I've seen in these studies. Now, the duration of the trials means how much data, how long have we been following these patients for, and how can you identify how long this COVID vaccine is going to be effective for. So the duration for Pfizer and Moderna, because they started earlier, are about 90 days now. We have good, really robust information and data that shows after receiving the vaccine 90 days out, it was still effective at 94, 95%. For Janssen, because it's fairly new, we only have 28-day data. I know that Pfizer and Moderna in a couple of weeks or months maybe are going to publish their 6-month data, which I've already skimmed at. It's not published yet in a journal, but we are looking at 6-month data that looks pretty similar to the data that we have here, which is super, super promising. We were all concerned that these vaccines would wear off at about the 3-month mark and that we'd all have to go get boosters. This is why the US bought so many vaccines in case that we all had to get boosters again. But now we're seeing pretty good data coming out for 6 months. So that's really, really exciting. And then I'm sure Janssen will follow in a couple weeks or months. And just to reiterate, Pfizer is going to be the 2 doses that you need to take 21 days apart. What should be happening is when you come in for your vaccine, your first dose, they should be giving you the appointment for the 2nd dose if you're getting Pfizer or Moderna. Moderna is 2 doses, 28 days apart. And Janssen is the only one that's the 1 dose. Still pretty effective. I mean, 74% is still really, really wonderful. Highly encourage if you're offered any of these to just take them. Now, the age ranges. So Pfizer is 16 and up. So that's the kind of youngest population that was included in the trial. Moderna and Janssen are 18. However, we just saw data. So Pfizer has another trial that's 12 to 15-year-olds. And that data is likely going to get published, and the FDA is likely going to approve that literally any minute now. They're showing that the vaccine is safe and efficient for children ages 12 and up, or for people ages 12 and up. So we will likely start vaccinating pediatric adolescent patients here, within the next couple of weeks. And again, this source is the FDA. I highly encourage you to look at this website, FDA, if there's any questions about who should or shouldn't obtain the vaccine. Again, all of these are safe for pregnant women and for breastfeeding, lactating people. So encourage everyone to take this vaccine. If you have comorbidities, that's even a bigger reason to get the vaccine. I know last time I had a lot of questions about people saying, well, I have this diagnosis and that diagnosis. Other than HIV, or if you're immunocompromised, like if you're on medications, and you would know if you're on biologics or high-dose steroids, pretty much everyone can qualify to take the vaccine. Obviously, the side effects, as some people have heard, is just the sore arm. It's a little bit more sore than the flu vaccine. And then we are starting to see a lot of side effects of just headaches, feeling really fatigued, I actually had a really terrible side effect with my second dose. I felt like I had the flu, and it was a quick 12 hours. And after 12 hours, it felt like nothing happened to me. It came and went so quickly. And I can answer some more questions later on about the different vaccines and who should or should not get that vaccine. Next slide. I think that might be it for me. Thank you.
Hi everyone, my name is Nicole Farrell. I'm from Beta Chapter and I became a sister in fall 2018. So we're gonna get started with some questions about the vaccine for Dr. Chan. So one thing for me is, so I know a lot of people that I've talked to, they said they've gotten COVID-19. So are they still eligible to take the vaccine, even though they had it already and they battled it?
Yeah, that's a really great question. So we know that after you have COVID, you're actually protected for 90 days. That doesn't mean that you can go out in the world and without your mask and not social distance. We just know that the risk of you contracting COVID-19 90 days after first testing positive is almost zero. After the 90 days, your immunity to COVID-19 decreases. So we are recommending that if you had COVID-19 to wait 90 days after you tested positive to receive the vaccine. I also just want to throw in anecdotally of the patients that I've cared for, people who have contracted COVID-19 a second time actually have worse symptoms. They get more sick. These people initially for their first round had very mild symptoms, and then the second time around usually have to be hospitalized. So it's a little bit more of an aggressive attack that your body makes to combat the COVID-19. So 90 days after testing positive, you can get your COVID-19 vaccine.
Okay, and then how safe would you say is the COVID-19 vaccine?
I think it's 100% safe. We haven't seen, and we've been following the data, we haven't seen any adverse reactions secondary to COVID-19 vaccination. And I do want to say Pfizer, this might be kind of a young crowd, but if anybody knows what a colonoscopy is, you have to drink this stuff called Go Lightly. It's a laxative. That's what's in the COVID-19 vaccine. It's that potassium, a little bit of salt, and then the actual mRNA. And that's all it is. So even if you have a ton of allergies, this isn't one of those vaccines that has eggs or gluten or any of those artificial things. It's just Go Lightly, which we give people 2 gallons worth to drink to prep for their colonoscopies. So this little bit amount that's going in you, maybe like 2 cc's, is going to be nothing to you. So really, really safe. Like I said, just kind of some local symptoms, arm pain, headache, maybe a little bit of fever. And those are good things because we know that your body is making antibodies to the COVID-19 vaccine.
Okay. Wow, I didn't know that. Like, I've been talking to a lot of people and they're like, I'm scared, like, I don't want to take it. But I know like a lot of people were taking it. So like now that I know this, I could be like, well, it's not that bad. Like, do you know what's in it? So I can relay that to them.
Yeah, no, absolutely. I think we've been having to do a lot of education, the healthcare field, especially in Black and Brown communities, right, that have experienced medical apartheid, that have had just racist things done to them by the medical institution. And I completely understand people's hesitancy, especially because this vaccine was made in the time of Trump. So there's like that layer to it as well. I'm not gonna lie, I think I was a little hesitant too, because the way that the vaccine came out was like this fancy press release. And that's not usually how science is done. We usually publish a paper and then people talk about the paper. They came out touting this vaccine without any data or facts. It was just kind of words. So a lot of us were really hesitant. I would say a lot of Black and Brown physicians were a little suspect and kind of waited a couple of days, not that long, because I think we read the research and we found that it's 100% safe. And as far as the data for side effects and really terrible things, that doesn't exist. There is no data that shows COVID causes, the vaccine causes infection, or that COVID causes death. I know that's kind of like a rumor that's been going on. None of that has been scientifically proven. Thank you for the question.
Okay, and then how do you think the COVID-19 has impacted or like marginalized the communities in the Black, Latinx, low income communities?
Yeah, that's a really great question. Well, we know that it severely impacted Black and Brown Indigenous patients, right? Because they don't have access to care, they have poor health literacy, and again, all of the racist things that have been done in the medical community to them all kind of, it was like the perfect storm for this infection for this virus to come in and really affect the most marginalized. Here in New Mexico, I am conducting an IRB, a study surveying all the patients that came through our COVID follow-up clinic. And we are seeing about 50% of the patients that came in were identified as Latinx, and 25% of them identifying as Indigenous, Navajo, Pueblo, which is like mind-blowing, right? I mean, we knew this anecdotally, but looking at the numbers just kind of prove that. And it's multi-layered. It's not having culturally humble, culturally competent MDs to take care of them, not having access to healthcare, not having access to food, climate change, fracking in the oil industry. All of these things have compounded to force these patients to be marginalized and minoritized. And so, of course, that patient population is going to be the most affected, especially because our family, Indigenous people, live in multi-generational homes where we have grandchildren, mom, grandparents, maybe like great grandparents. And so when the younger people in that family have to go to work, they're coming and going and bringing that COVID infection. And we also know that these people work low wage jobs, so they weren't able to work from home, right? So it's a compounding of they're marginalized and we haven't cared for them as well as them having to go out to work and increasing their risk of exposure.
Okay, and then how would you explain this like to little kids, and like if they ask questions like how long does this last or how is this working, like because obviously like you can see that it's only for 16 and up or adults, so how do you explain that to kids like, okay, it's not your time yet, but we're figuring it out?
Yeah, that's a more tough question because I don't deal with children. But I would like to say we don't give children enough credit, right? We are almost ageist ourselves, where we don't give them autonomy. We don't let them make a lot of decisions because we think, oh, they're not old enough to make their own decisions. And I think just being really honest with them, right? That we've seen that the most affected populations are our elders, 65 and up, right? So this is almost like a sacrifice that they have to make to protect abuelita, abuelito, and to just wait their turn, as most of us here are doing, right? We're all in our 20s and 30s. I was a frontline worker, so I had access to the vaccine. But if I hadn't been, I would still be unvaccinated today, and you all will still probably be unvaccinated for the next couple of weeks or months. And so it's just a sacrifice that we have to make, and try and explain it to them. I don't know, I'm not a mom, I don't have children, and I don't interact with children, but I hope that helped.
No, definitely. And then my last question would be, how long does the vaccine last for?
Yeah, so I kind of briefly went over that. So we're thinking at least 6 months now. That data is going to come out probably this week or next week. 6 months, which is phenomenal, because we can use more of those vaccines to vaccinate younger populations.
Okay.
And we did have one question in the chat. It was, where'd it go? What else can we share with our family/friends who are still worried about myths about the vaccine, that it's safe?
Yeah, I think personal anecdotes work really well and being really honest, right? So I do this a lot. So every patient visit, so all my primary care clinic patients, I ask them, have you registered for the vaccine? And if they say, no, I'm hesitant, I ask them, well, why are you hesitant? I highly encourage you to go on the FDA website. They have these little fact sheets that are really, really wonderful and easy to read. And then if you know somebody that's been vaccinated, or if you yourself have been vaccinated, it's really nice to just give your personal anecdote. Like, I personally took it and I didn't have any side effects, or yeah, I took it and you know what, I felt really crummy for 12 hours, but then I felt great afterward and now I'm protected, right? So just kind of personal anecdotes. Again, I read you the ingredients, just telling them about how the ingredients are safe. And then reiterating, and this might get a little too sciencey, but I'm just just overjoyed by how we created this vaccine. It's such a like novel science. It's like so ingenious, and I'm just like so in awe of the scientists that created this. This is like my science nerd hat coming on. It's actually it's an old way of creating a vaccine. Like the polio vaccine was created this way. The actual vaccine doesn't have any virus in it. So like the flu has killed virus, or a little bit of live virus, depending on what you get. This doesn't have any of the vaccine of the virus in it. What it has, and if you, I think we have pictures of the coronavirus, it's like a little ball and then it has like a little crown. That's why we call it corona. That's what we're giving people, is the mRNA to that crown. So what's going to happen is that mRNA is going to go into your body. Your body's going to want to make some of that crown. As soon as it does that, your body's going to make antibodies to that crown. So whenever it sees a crown now, it's going to have antibodies to that. And that's why we think, we were still seeing the variants, but we think that all of the variants are going to be covered by the vaccine, which is like mind blowing, because the virus can mutate 1,000 times. And as long as it still keeps its crown, then the virus is going to be effective, which it should, because coronavirus is called corona because of the crown. So where can people get access to the vaccine? So that's it's going to be very different for different states. I know somebody earlier had submitted a question about how has New Mexico efficiently rolled out their vaccine. We actually are probably one of the top 3 states that has the majority of their population vaccinated already. One, I think I was talking to Kiara last night, but I was like, we have a Black woman running our vaccine rollout, a Black MD. So, Black and brown women, we just get shit done, right? So, like, leave it to us, like, right? I think I saw memes about like how our moms make like 1,000 tamales and feed like the whole neighborhood for Christmas. Like these are the people we need running the vaccines, people that just know how to get it done. So we have wonderful Dr. Dean Collins. She's wonderful. She's in charge of our vaccine rollout. In New Mexico, it's all run by the Department of Health. So it's localized in one site. And I think that's what's helped, because there's only one number, one website, one place that you can sign up to get the vaccine. And we have a volunteer list of 300 people working there, helping people organize and get vaccinated, versus I just signed up my parents in Cali to get the vaccine. And there are like 20 different websites you can go to. It's all 20 of them ask you 20 different things. Sometimes people ask for insurance. Sometimes people ask for comorbidities and all this information. And if you can imagine, our elder, like my parents, right? They're in their 60s. They don't really know how to read or write that well. God forbid they go on the internet. There is no way that they're going to navigate that, right? So they needed me to help. And so it just depends on what your state is doing. I would, for the first step, is just go into your state's Department of Health website and just see what information they have there. I think that's probably the best bet. Why are there multiple vaccines? So there are multiple vaccines. I think the short of it is capitalism. Unfortunately, healthcare is still a for-profit business. And, a year ago when we saw coronavirus pop up, already people were thinking money, let's get a study going, let's be the first ones to create a vaccine. And so different companies started working on creating this vaccine. However, you know, there are other places across the world. So I will say that the US has the largest library of coronaviruses. So there are like 1,000 different coronaviruses, and most of them just cause like the regular flu, like when you just kind of have a cold, like a runny nose, a fever, a headache, or like intense flu. Those are all coronaviruses. The US had the largest library of that, and then China had the samples, right, because they saw it first. And so we collaborated together. But of course, like China, every country has their own business or company that's creating vaccines, and that's why there's so many different vaccines. As a doctor, do you still think the next wave is going to be as bad as they've been with the vaccine rollouts? It's so confusing seeing Germany, Italy, and France are on lockdown again, and we are opening up again. Yes, absolutely. That's a great question. So again, I will say capitalism, the US bought up a big majority of the vaccines, which unfortunately forced other countries to not be able to buy any. So a couple months ago, you know, we were looking at the entire continent of Africa only had about like 20 to 50 total vaccines that they were given, versus us, we had like millions of them, right? So this is why other countries probably don't have access to the vaccine and are not creating that herd immunity. And so COVID is just running rampant again in their countries. A place like Brazil, who has, you know, like the Brazilian Trump as their president, has never really closed down. The president doesn't believe in masks. Unfortunately, a lot of the vaccine, I forget which one they bought, was not manufactured properly, or maybe was not shipped properly. So they lost, you know, millions of doses of their vaccines. So their numbers are like through the roof. They're surging. They're still under our numbers, which is incredible because we have a good vaccine rollout here in the US for the most part. So that's why other countries are closing. And I think we have this false sense of security that people are getting vaccinated and I can travel and I can gather. And so people are just feeling like, oh, the vaccine's here, everyone's protected, so I can go out and go have fun. And that's actually not the case, right? So like I said, we are preparing to have a surge after this Easter, so about 10 to 14 days after Easter, because we are expecting people to gather. And so again, I urge you not to gather. If you're not vaccinated, please don't do that. Obviously, if you're vaccinated, you can. The CDC actually said that if you're vaccinated, you can travel. I would highly encourage you not to travel out of the country though, because we know that other countries don't have high vaccination rates as ourselves.
All right. Thank you, Nicole. Thank you, Krystal, for all of that. I know we had a few questions still pop up. Krystal, I think you can answer them in the chat if you want, but we're gonna give it off to Claudia.
Hi, Dr. Chan. First and foremost, thank you for that fascinating information, because it's really crazy to hear all about that and how our country is like really moving quick with trying to distribute the vaccinations. I'm going to talk a little bit about community impact. I know we already touched on it a little bit, but I really want to know, based on the chart that you provided to us, there is like a low number of Indigenous people tested, or Latinx and Black. Do you think that there should be more tests done for these groups of people, just to be on like the safe side, or do you think kind of like what they already have done is enough?
No, absolutely. That's a great question. It's not enough, and I don't think it's ever going to be enough. Absolutely, they need more testing. Absolutely, I think that those numbers of Black and Indigenous people that were infected are actually lower than what the true number is, because a lot of people just don't have access to testing. Again, you know, our elders don't have access to the internet, don't have transportation, right? So yes, we need more testing. I know that earlier on we ran out of the reagent to test. So we had like the kits to test, but then you have to put some like reagent on it, and we ran out of that. And so it's just a lot of multi-layers of why Black and Brown communities probably have a higher rate of infection, but we just don't know. And if that is just poor access to testing.
And then there's one that came in. As a college student, I am scared of the likelihood of contracting COVID-19 once returning back on campus, even with a vaccine. How do I combat the fear with that?
So we know that the vaccine is pretty effective. It's 95% effective, 94%. If you have the Janssen, it's lower, 74%. This is why we're still encouraging people who are vaccinated to wear your mask, to try to social distance, to hand wash, even if that's not a mandate in your state, right? So we see a lot of states, Florida, Texas, for example, Arizona, that never really went on lockdown, that never really had mask mandates. What we're saying is masks work, hand washing works. And so continue to do that, even if that's not mandated by your state, by your school. These are all really simple things that you can take to protect yourself and to protect others and to protect your family, you know, because a lot of us go onto campus and then come back home. So we can for sure continue to do that, but feel a little bit more secure and safe after you've been vaccinated.
Perfect. And then also, we see, like you said before, that New Mexico is kind of like one of the states that is the whole population is almost all vaccinated. How can we, you know, do that in other states, like raise the vaccination rate and then like achieve that much of a rate?
Yeah, so in New Mexico, we also have the IHS system, which is kind of like socialized medicine, who really took charge. They immediately just started vaccinating everybody 16 and up. Like just come. I think the first couple of weeks in December and January, they did prioritize, I think 70 and up, 65 and up. And they just were like, yes, let's, you know, these vaccination centers were open like all hours of the day, you know, 4 a.m., 7 a.m., all the way to like midnight. And that also has to do with the vaccine itself. Pfizer has to be like ultra freezed, which means once you take it out of the ultra freezer, it's like a ticking time bomb that it expires in 4 hours. So that's why we just had to like move really, really quickly and not waste vaccine. And that's why, you know, when we had a handful of people show up at 8 p.m., we would open a new box. And so we had 4 hours till midnight to vaccinate people. So it really was a around the day job us vaccinating. So just keeping vaccination hours open. We also know that low wage workers, right, do work night shift or do work these third shifts, and they can't come in during regular hours to do that. Having vaccination open on the weekends, like what a novel idea, right? Like accommodate the people that live in your state.
Yeah, definitely. And then I had one more question, I believe. I was gonna ask, I know some, like some states, they started out by distributing the vaccine depending on your age group. Do you think, and like as time continues, it'll be opened up to more groups, you know, more easily accessible? What are your thoughts on that?
Yeah, absolutely. So we're seeing in California, so I only have, you know, information for New Mexico and Cali. But in California, we just opened up to 50 and up. Here in New Mexico, I think we're still doing 65 and up, and then anybody with comorbidities. I'm thinking that probably by the beginning of summer, it'll be open to everyone. Now that might change because we didn't really realize that Pfizer was going to have such great data on pediatric patients. And so that is going to come out soon. So this might change within the next week or two. As with everything in COVID, I feel like whatever I said yesterday might completely change tomorrow. But I'm hoping, I think because schools are opening up. I know New Mexico just opened up or is going to open up on Monday. Sounds like Cali, parts of Cali opened up a week or two ago. We know that kids can still get infected and can still pass the infection. So it would be a priority to vaccinate children as well. So I'm hoping by summer, it'll be open up for everyone, maybe 12 and up. Somebody asked, do you think this will pass, or will we have to continue with this way of life with masks on? That's a really hard question. And that's kind of like a question for Dr. Vidot. What I'm thinking is this is probably gonna last for the most of this year. We also are going to wait to see, like the flu, we have like the flu season, which is like September through April-ish, May-ish. COVID might become something like that, where we have a season of COVID, or it might be 2 seasons of COVID, where it's going to be spring and like fall, winter. But for now, I think that there is a new way of life and a new normal. And now I'm even kind of thinking about my prior practices, and I'm like, oh, I don't ever want to like share a drink with somebody, or like eat off of somebody else's plate, or even in my clinical practice, when I look in ears and nose and mouth, like I can't believe I would do that without having my mask, my mouth covered, or my eye shield on, because I'm getting so up and close and personal to someone's like mucous membranes that I feel like for the hospital, like for healthcare workers, I think probably masks and shields are probably going to be a new thing that we're going to do forever. And I actually feel a little bit more comfortable doing it that way now that I've been doing it that way. Can I continue reading questions? I'm not sure. Is there a scientific explanation for folks who don't contract COVID? I remember hearing that folks with a certain type of blood don't seem to catch COVID as much. Is that true? Not a lot of science behind this, but I know people are looking into this. I don't think it's so much that they don't contract COVID. I think that they are asymptomatic carriers. So for example, like myself, me and my husband did COVID, have done COVID care for a year, and there's no way that we were like up and close to patients like that without contracting COVID. So that's kind of strange to me. And I feel like maybe we were just asymptomatic carriers.
Sorry, everyone. Technical difficulties. I'm pulling something up here for you. Hopefully everyone can see this. Sorry, y'all. Seeing all my screens. But yes, we will just kind of wrapping up, finishing questions. If you have any further questions, please email the National Undergraduate Affairs Committee Chair at lambdalady.org, or visit the LTA Foundation website for more information or resources. I think we have a few more minutes. Krystal, if you wanted to finish answering any questions that we had in the chat, or if we got to them all.
I just wanted to highlight the website that we have. It has a recording of our winter presentation that we did that has more information on COVID infection and what to watch out for. I think the side effects of the vaccine, which I said is like very minimal, neither here nor there. When patients come to me and they say, well, I react really terribly to the flu vaccine, or I'm really scared of being really sick after I get my COVID vaccine. And usually my go-to answer is, I would rather be sick for 12 hours or 2 or 3 days than die from COVID. So you take kind of your drug of choice there.
Perfect. Thank you for answering all of our questions and for giving us more data on that. So I will then hand it over if it wants to go. I'll hand it over to our sibling, Alyx, and I'll have her introduce herself. And we'll kind of go into meditation, just because we have just been going through a whole pandemic for a whole year, and just kind of, we need kind of just some time to just take for ourselves.
Good morning or good afternoon, wherever anybody is. My name is Alyx Sueitko Delgado. As you see there, I crossed Gamma Chi, Spring 12, active through Alpha Gamma, and part of the Promesa team. But professionally, I'm a mental health professional in the Austin area. And now that a lot of things have gone online, pretty much Texas. So my license is anywhere. So if you're looking for support, in other areas of mental health, you can reach out to me, because the entire mental health field has kind of like interacted, since we're all statewide. Like if somebody moves to Dallas, or they were stuck in Dallas and they're my client, I could still work with them. So resources have been going back and forth if anybody needs support, or if you're outside of Texas, I can help you find support if you need that as well. So my expertise is actually guided meditation. I do this with my clients at the beginning of every session, regardless of where they're at, to kind of give a baseline so we can, work through whatever it is that they need. And one thing I want to talk about meditations, this one will be about 10 minutes, but there's meditations that are a minute, 5 minutes, a whole hour. I know sometimes people talk about meditation, and I don't have time for meditation, but you can do this anytime. You can do it anywhere. You can do it in the shower. You could do it in between clients. You could do it in the car right before you go in, if anybody has kids or they live in a kind of heavy environment, like if you live with parents and so on and so forth. So you can do this anywhere. I'll be guiding you through. I'm going to turn on the music. For this part, I usually let my clients know that they can turn their camera off if they'd like to, because during meditations, it's kind of a personal time, a personal space. You can definitely turn off your camera if you'd like to. Okay, so I started the music and I'll guide you through the meditation. So first we're going to start off with a grounding meditation, and then we'll go into something that's called a body scan. So I suggest everyone find a comfortable posture. This can be sitting down, it can be lying down, as long as you're on a flat surface and you make sure that everything around you is going to keep you safe. Allowing your eyes to close gently if that feels okay, or lowering your gaze. Bringing the attention into areas of contact that your feet have with the surface that they're on. Feeling into your feet. Noticing the solidity of the surface under your feet. Maybe feeling where external materials are in contact with your feet. Now moving on to the thighs and the buttocks, and noticing where they have contact with the surface that you're on. Just allowing the ground and the surrounding surface to hold and support your body without you needing to do anything. Now moving the attention to your back. Where does your back touch the back of the chair or the surface that you're on? Can you feel the difference between where there's contact and where there's none? Now moving your attention to your hands, feeling into your hands, noticing the position of where they're at, maybe noticing what they're touching, perhaps a chair or your thighs. Maybe they're touching each other. And in this moment, I encourage you to ask yourself, how do I know I have hands without looking? Many times we just know, we can feel our hands from within. Now I invite you to open your awareness, feeling your entire body, just sitting or lying there, in this moment, on this surface. For the next minute or so, we're going to bring our attention to the breath. If you like, you can take the next couple of breaths a little bit deeper so you can really feel the breath. Ask yourself where you feel it the most, or where the sensations are the most pleasant. Maybe at the nostrils where the air comes in, at the back of your throat, in your chest, or maybe in your belly. Using this place as the anchor for your attention. This is where you will come back to over and over should your mind wander off. Now letting the breath just breathe itself, No need to make it any other way than it wants to be. And when you notice your attention is somewhere else, gently bring it back to the breath. Breathing in and out. Remembering your anchor where you have your attention. Bring your mind back to the breath. Now, feeling into your body, just lying or sitting here. Feeling into areas of contact in this moment. Reminding where your feet are touching the ground with the surface. Where are your legs? What sensations do you feel in your back, in your arms, in your head? Noticing your breath, how it enters and leaves the body. We're going into something called a body scan. The intention of this is to be present with your body without wanting anything at all from your body, not even relaxation. Of course, it's nice to relax and it's great if it happens, but that's not the goal of the body scan. Our goal will be to check in with each area of the body in a non-judgmental way. You simply feel what is there to feel. No need to stir up sensations by moving the body. And noticing that there are a number of areas in the body you might not be able to feel at all. And that is normal and okay. Just checking into these areas and being aware of what you can feel. Starting back with the feet and feeling into both feet right now. Feeling into the areas where your feet are touching the surface. Feeling into your toes or not. What sensations do you feel? Perhaps tingling or temperature? Now moving the attention to your ankles and lower legs. What is here to feel, if anything at all? Pressure of your calves against your surface, perhaps the fabric against your skin. And if you notice that your attention is suddenly somewhere else, just gently and without judgment, return it into your legs. It's not a problem at all. The mind likes to wonder. If you find it helpful, you can imagine that you're breathing into your lower legs as if your attention could ride on the breath. Or as if your attention could light up that area like it was a flashlight. Now letting go of the lower legs and moving the attention into your knees and thighs. What is here to feel? Again, maybe pressure or temperature, perhaps the position of your legs or nothing at all. Numbness counts as a sensation in this practice. Noticing that thinking about an area or picturing it in your mind's eye is different from actually feeling it. Now letting go of the thighs and moving the attention to the lower trunk, the pelvis and the belly, up to the belly button. Noticing any sensations in this area. You'll be feeling the breath in the lower belly or not. Then letting go and now feeling into the upper trunk, the stomach area, the chest. The feeling, the sensations of the breath are here with each inhalation and each exhalation. Feeling the spine against the floor or the back of the chair or the surface you're on. Noticing any sensations that are here or any absence of sensations. From here, now moving the attention into your hands. Feeling into your hands. You might notice how well you feel your hands without having to see them. Feeling the individual fingers, feeling the position of your hands. And when you're ready, moving the attention to the wrists and forearms now. What is here to feel? What do you touch? Is there pressure, warmth? Now moving the attention to your elbows and upper arms, noticing any sensations here. And if your mind wanders off, just bringing it back to where we are, just starting again. From here, moving the attention to your shoulders, the back of your neck, and then feeling into your head, feeling into the lower jaw, and into the different areas of your face. What does your face feel like? Noticing the mouth, your nose, cheeks, eyes, forehead, your entire face. And now opening the awareness to include the entire body again, lying or sitting where you are, being alive and breathing. If you like, imagining to be breathing from the crown of your head all the way down into your toes and up and out again. Noticing all the sensations of the body and allowing them to be just as they are in this moment. As you continue to breathe, I welcome you to feel into an area of the body you noticed before that you'd like to bring more attention to. Breathing into that part of the body and letting go of whatever it is you feel. And as you're breathing and feeling into the different areas of the body, should your mind wander off, just bring your attention back to that area and start again. Allowing yourself to explore the sensations of the body, breathing in and breathing out. In a moment, we'll hear the sound of chimes. And in that moment, I will ask you to come back into the room with everybody else. But until then, breathing in and breathing out. And with these chimes, I invite you to come back into the room by first allowing some movement back into the body, like wiggling your fingers and toes, scratching the body in any way it wants, stretching, if that feels good. And whenever y'all are ready, you can turn your cameras back on. And that is the end of the meditation. So that one that I did, I actually fused two meditations together. I did the grounding meditation first and then the body scan. They can be done separately, they can be done together, and there's so many different ones. There's loving and kindness, there's meditating at work, there's meditating for clarity. There's so many different kinds of meditations. And there are apps now that are derived for people of color, voiced by people of color. There's even some that are in Spanish. So I'll give those resources over. So y'all can have different apps and different opportunities to explore meditation and guided meditations. Thank you so much for letting me guide you through your meditation today. And I will give it back over to Kat.
Shout out to her sibling, Alyx. That was a great meditation. I love meditation. Helps me kind of recollect myself. So we can go on to our next slide, maybe if it wants to. I will hand this over off to Kiara to talk about.
Yeah, thank you so much, Alyx. And we want to give a huge shout out and thank you to Dr. Krystal Chan as well for giving us so many answers and walking us through so much information. So thank you both. So we're going to go ahead and close out the event. I did also want to shout out the undergraduates within LTA. Our membership has been super resilient through this year. Our membership has been resilient, innovative, and super impactful with everything that has been thrown their way. You all are awesome. We have some undergrads on the call right now, Kat, Nicole, and Claudia, that are absolutely phenomenal and superb leaders in their universities as well. For LTA in spring 2021, we had 1,641 active members, 655 of which were undergraduate members. So these are university students across the nation, still putting in so much love and support for their university partners, for their community, and as well as their sisters and siblings as well. So we really want to thank them. And then Kat, do you mind moving a little bit forward? I also wanted to spotlight the Undergrad Affairs Special Committee. They had some awesome events this year as well. You might recognize some faces on the flyers as well. We were trying to really create and embrace the virtual space to provide undergraduates really a space to be able to come and learn more, but then also kind of give them some opportunities to see other undergraduates from across the nation when we can't really do that in person. And we were able to learn a lot through this experience. And we also want to give a huge shout out to Julia Maestas. She was a big pioneer for this organization, for this committee especially. This is why a lot of us on the committee met each other and really embraced our leadership position. So I really wanted to give her a big shout out and a lot of love as well. So with that, we're gonna go ahead and close out the event. Dr. Krystal Chan and Alyx, do you all have any closing remarks you would like to say as we close out?
Yeah, I think I just wanted to reiterate everything that you just said. I am just so highly impressed and humbled by how quickly our sorority took the COVID-19 task force recommendations and just revamped literally the infrastructure of our entire sorority. It was super amazing. We were, I should say, I was very nervous and anxious and hesitant to give recommendations about, you know, stopping all in-person activities. I wasn't sure how people would take that. And I was just so pleased with leadership, you know, to take our expertise, and I don't know how they did it over the summer, but just kind of revamped everything. And then just personally seeing the line cross here in New Mexico was amazing. I don't know how they did it virtually. They even created a little video, and I was just like, shout out to them. And then shout out to my chapter who held a really phenomenal founders event. I think this is one of the first times I was able to attend because I haven't lived in Cali since 2012 or 13. And so it was just nice. I feel like, you know, we do have Zoom fatigue, but it's nice to be able to connect with people virtually and still feel like we're a part of something and be able to meet sisters from all across the nation. It brought me back to kind of some Neil feels. So shout out to the undergrads and to leadership for really revamping our infrastructure and making it work in the time of COVID. It's super impressive. Thank you.
Definitely echoing what Dr. Chan said and what y'all already said, Kiara, and really believing it's okay not to be okay. I mean, we're in a pandemic, and undergrads, you're going to college online. So really, it's okay not to be okay. If you have resources on campus, reach out, because I promise you, you pay for that with your tuition fees. So use the resources you have on campus. If your resources on campus aren't helpful, especially during these times, reach out to community orgs, reach out to me, I can help you. Or if somebody in your chapter or in your area needs support, I can help you find someone who's BIPOC or who, whatever identities that you're looking for. There's a counselor out there that either meets those identities or have worked with that population before. Because I know how it is to work with cishet white men who don't understand any of the issues you're trying to go through. Half of them being my colleagues. So I totally get it. It's okay to not be okay, and to reach out and ask for help, even if you feel like, oh, well, other people have it harder than I do. Everybody deserves support if they need it or if they want it. So definitely reach out if you need support or if you'd like support. Even talking to someone from, on a weekly basis can be helpful with your mental health during these times.
Thank you so much. And then I'll pass it over to Kat, Nicole, and Claudia. Do you all have any closing remarks, or how did the event feel?
Thank you to everyone for coming. This was really insightful. I worked at the hospital during the peak times back in my hometown here in Iowa. As you saw, Iowa kind of had a high COVID rate. So it was really nice just to get some more information about it and just to let everyone know that the vaccines are safe and that they'll be coming out even faster now. So thank you, Krystal, for that. Alyx, thank you for the guided meditation. Again, I really love guided meditations. So it was just nice to kind of do that and calm myself down a little bit.
I'll go next. So I want to say thank you for everything, for organizing this, this meeting today, and the meditation. I always look forward to it. Like, it always kind of brings me down, like says like, okay, like I'm okay. I had like a rough week, but at the end of the day, like it's okay not to be okay. And like I needed that. And then now that I got this information about the vaccine, now I can relate it. And I'm actually a chemistry major with a concentration in biochemistry. So I was like, yay, I love science. So I was excited to know more, because I personally haven't taken the vaccine. I've been kind of skeptical, but now that I know this information, I'm like, okay, now I'm going to do my research. I'm going to go get vaccinated, go make the appointment. So like now, like this is like kind of my step in the right direction. So definitely thank you.
Yes, I couldn't agree more with Kat and Nicole. Like, I really appreciate this event happening, and like honestly, our organization kind of taking this step, like you said, to really just spread more information on the vaccine. And like with the information that you gave us, I'm really gonna go out and like even with my own chapter, hey, we kind of have to. This is a really important information that we can tell our parents, our friends, our extended family. So I really appreciate that, and I kind of was more comfortable, I guess, talking about the subject. And then, of course, reaching out if I have any questions. And then the guided meditation, perfect ending to this. It was exactly what I needed to kind of like bring it all back and kind of just be comfortable with, this all happening all so fast. And then I really appreciate you guys for being here.
Awesome. Thank you, everyone, for your awesome thoughts. We also have Wendy on the call. We want to give her a huge thank you, the Director of Recruitment and Retention, for really guiding us through this and providing us more information. Wendy, did you want to say anything?
I just want to say thank you to everybody. Thank you to our wonderful undergrads, because without you, we would not be able to do all the wonderful things that we do here in Amsterdam Alpha. And of course, to our alumni who give so much of themselves, and to the Undergraduate Affairs Special Committee and our DUA, Julia Maestas. I really appreciate you and love you.
Yes, so thank you everyone for coming today. Yes, a huge shout out to Julia Maestas for leading us through all of this as well. We are very grateful for her, and we are very grateful for the committee. So thank you everyone for joining us. Again, if you have any questions, feel free to email us, reach out, go ahead and visit those websites and pass on the information. So thank you again and have a lovely Saturday. Bye everyone.